Okay, so hello everyone, welcome, and I am thrilled to introduce you to our guest speaker for this week. So her name is Malika Mahmood, and she's a first year med student at Anglia Ruskin University, and she carved her own path into medicine as a graduate. So she's going to be giving us her honest and insightful experience of choosing an alternative route to get into medicine. And she's going to be talking about the challenges that she had to overcome, as well as strategies that helped her secure her place. So thank you so much for joining us, Malika. And if anyone has any questions, feel free to put them in the chat. And then, of course, we'll have a Q&A session after the talk. So I'm going to unshare my screen and hopefully you should be able to share yours.
Yep, thank you. Okay, so thank you very much, Neha. Can everyone hear me first? I'll just confirm that.
Yes, we can hear
Yep,
you.
okay, perfect. I can't see the chat now, so Neha, if you can just interrupt if there's anything in the chat. So, like Neha said, hello everyone. So, my name is Malaika. I'm a year one medical student at Anglia Ruskin University. But alongside being a medical student, I'm also a biomedical sciences graduate. So, I'm going to be talking to you guys today about my personal journey into medicine, but also kind of the alternative routes that are available to getting into medicine, as often people only think there's only one way in, and that's not the case. So I'm going to be kind of exploring the other avenues and the other paths into medical schools, and how you can get about it. So about me and my journey. So my journey kind of started back in about when I was in year nine, year 10, which was a very, very long time ago to think about it now. And a bit cliche, but it started off from when I had braces and I used to go to see the orthodontist every 6 weeks. And I realized then that, oh, this is quite a cool career, being a dentist, not really realizing that I was going to an orthodontist, not a dentist. And I thought, okay, I'm going to be interested in doing something like this as a potential future career. So I got interested in a career in dentistry. And I was kind of preparing throughout year nine, year 10, year 11 with my GCSEs. But unfortunately, I was one of the unlucky years that got struck by COVID pretty badly in the sense that I actually didn't do my GCSEs. So I got predicted grades for my GCSEs. I'm lucky enough that they were pretty good enough. They were quite good. I was very happy and pleased with those. And then I went into my A levels and I did A level biology, chemistry, and history. I didn't go down the path of doing what is known as the Holy Trinity with biology, chemistry, maths. I did biology, chemistry, history because I personally really loved history and I just didn't want to do maths, to be honest. And I did my fair share of research before choosing my A levels, and I saw that you don't really need those three. It's not a necessity to get into dental school at that time. Rather, you only need two out of those three. So I chose biology, chemistry, and history. Now, A levels, as I'm assuming most of you over here know, is very hard. They're very, very difficult, and I'm in my first year of medical school now after doing a whole degree, and I can still say A levels were the hardest thing I've done. They were very, very difficult. Um, but yeah, they were quite difficult. So in year 12, summer of year 12, I sat my UCAT. Now, I'm not going to lie, I didn't have the most guidance at that time with how to get into dental school or medical school because the process is very similar. The idea of the UCAT, I knew it was an exam. I didn't really know what it entailed or what it had in it, how to prepare for it, how to revise. I had no idea. I kind of just winged it, to be honest. So yeah, I sat my UCAT. I did okay-ish. I didn't do amazing, but I was like, it's okay, I'm gonna try. So then I applied through the UCAS application for four dental schools. My predicted grades as well, from what I remember, they were A star AA. Yeah, I think they were. They were A star AA. But unfortunately, my my UCAT score for dentistry was just not sufficient enough. So I didn't actually even get any interview offers. Instead, I was kind of left with four pre-interview rejections. Anyways, I had a fifth, safe option of biomedical sciences, which I didn't really think about at the time. I just kind of thought, okay, I'm going to speed through my A levels and we'll see what happens. So A-levels came around. I did my A-levels. Again, I did okay. I got ABB. That was not enough for dentistry, definitely not. So for me, in my head, I was like, right, what do I do now? I had secured my fifth option of biomedical science. I had my offer, and in fact, I confirmed that offer because I assumed, so this was an assumption I made at the time that a lot of students make, that resitting my A levels isn't an option. Now, I'm going to go into a bit more detail of this a little bit later on, but I thought resitting my A levels isn't an option, and all the dental schools will reject me, so I can't do that. So for me, in my head, my next best option was to start a degree. So I started my biomedical sciences degree. Now, these 3 years, with hindsight, looking back now, were the best 3 years of my life. I had a blast. I had a great time at university doing my bachelor's degree. I not only developed so many skills within my degree, like critical analysis, lab work. It's biomedical science, so it was very related to medicine. Kind of the theory of medicine was involved in that degree. But not only that, I just had a great time, to be honest. Like, it's not as pressured, it's not as intense, it's a lot more subtle compared to medicine. Well, that's what my personal experience was. I can't talk for everyone, but I had a great time. And alongside doing my degree, I always had in the back of my head that I still want to do dentistry. And to be honest, I started my biomedical science degree with the sole intention of doing dentistry in the end. So throughout these, especially the first 2 years, I really not only focused on getting the top grades for my degree, but also strengthening my application for dental school. So I did lots of work experience because I didn't get to do any work experience when I was in A levels because I was a COVID year and pretty much nowhere was taking any students in for work experience, volunteering, no one was taking in anyone, which was a shame to be honest, but with hindsight, it all worked out in the end. So yeah, I got work experience in dentists. I worked part-time throughout my whole degree in pharmacy as a pharmacy dispenser, which was again quite lucky for me. But yeah, once I finally got work experience in the dentist, I was there for about 2 weeks, I believe. Was it 1 week? No, it was 2 weeks. And I kind of realized that I don't know if this is for me. I thought what I thought dentistry is back when I was in year nine looking at the orthodontist as a patient, it's not the same as actually practicing it as a clinician. And I started rethinking massively whether this is what I want to do as a career. So to kind of look at my other options, because I always knew I wanted to be in healthcare just because that's the kind of personality I've got. Obviously, I worked in pharmacy, so I knew what it was like to be a pharmacist because I had worked very closely alongside the pharmacist. Then I thought, what about medicine? Why not? Why have I not thought about this before? So what I began doing is I started volunteering in one of the really big hospitals in London, St Bartholomew's. I don't know if anyone knows that, but it's one of the big hospitals in the city. And I basically realised then and there that my calling is medicine, and I absolutely loved volunteering there. I used to go on the wards. I used to run around the hospital. I was lucky enough to actually shadow a few doctors in surgeries. Basically, I just had an amazing time volunteering at the hospital, and I realised this is what I want to do. I realised this about second year of uni. And similar to when you do your UCAS application during A levels, you do it just in this kind of the summer. You do your UCAT in the summer just before your last year of your A levels. Similarly, with your degree, when you apply as a postgrad, you do your UCAT in the summer just before your final year. So I was set on, okay, I want to do medicine. And then I spent the whole of pretty much my second year summer preparing for my UCAT. And I gave it my all this time. I was much more prepared because I did a lot more research this time. I knew what was entailed inside the UCAT. I knew what I need to do good. I knew how I need to do it. I knew what resources I needed to do. And I really, really focused because, in all honesty, I hands up admit I was quite immature when I was in year 12 and I didn't really know what I was doing with the UCAT. So this time I was a lot more prepared and I did my UCAT and I was lucky enough to get a much, much better score. At the time it was 2950, but now I believe that's equivalent to 2200 because when I did it, there was an extra subsection. But yeah, I think 2,950 in my time is equivalent to about 2,200 to 250 now. So, yep, I did my UCAT. I sent my UCAT application off for medical schools. I received 4 interview offers as well. And in the end, I got 2 offers post-interview, and I settled on one, which was Anglia Ruskin. And luckily enough, I worked hard enough throughout my degree to actually finish my degree with a first-class honours, which was a big achievement. And yeah, so I ended my degree for my 3 years, first class and an offer to study medicine, and I confirmed it at Anglia Ruskin. So I'm just going to have a quick rain check. Does anyone have any questions? I can't actually see your questions, so if someone can just shout them out.
I don't think we have any questions so far.
No? Okay, that's fine. That's absolutely fine. So that was my kind of journey. But my journey was my personal journey, of course. It doesn't mean this is the route to medicine. There are many routes to medicine. You've got the classic post A levels route, which I don't want to say majority of people take, because when you go to medicine, you realize that not actually majority of people take that. But it's probably the most time efficient, where you do your A levels, you get in straight after your A levels, and you're into medical school straight away. After that pathway, there's another one, which is the foundation/gateway pathway, which I will go into a bit more detail. And you can also take a gap year, or you can be, like me, a postgrad. And even within postgrad, there are 2 routes. You can go into GEM, which is graduate entry medicine, or you can go into undergrad medicine as a postgrad student, which I'll go into a bit more detail. So the classic post A-level pathway. This is kind of the one that your schools will drill into you over and over again. You need very strong predictions or grades for your A levels. Typically, it's around A star, AA to 3As. Most unis, I believe, they usually have it in a range, A star, AA to AAA. They won't specify. It's obviously case dependent as well. You would also choose your options for medicine through UCAS. So you would usually do 4 options. And then a 5th choice would be something else. So like in my case, when I applied to dentistry during my A levels, I did 4 dental schools, and my 5th choice was biomedical science. Then you do your UCAT, and something I'm going to really go on about, and I'm going to go into a lot more depth about this later on, is strategic application with SCORE. This is something that you'll hear me go on about in each and every pathway that I'm going to talk about, strategically applying based on your UCAT score. I'm going to go into a bit more depth in that later on. But yeah, you want to do that during your A levels, and then your interview performance matters. It can almost make or break your application, your interview. If you get far enough to getting an interview, you want to make sure that your interview is top notch, and you want to make sure that you wow them pretty much. You don't want to give them a chance to think, oh, do we want to give this candidate a chance, even though on the kind of the statistical side of it, you're perfect, but in person, are we feeling that vibe? So you want to make sure you really wow them. Again, I'm going to go into a bit more detail about the interviews and how they work and stuff like that in a bit. So that's the classic post A-level pathways that majority of people think is the only pathway that exists to get into medical school, because this is what's drilled into us when we are at sixth form or college or school. The next pathway is the foundation/gateway pathway. Now, this is eligibility dependent. So basically what this means is some applicants are often meeting certain requirements for widening participation or contextual offers. What does that mean? So what does widening participation or contextual offers mean? It essentially means that your offer for medical school may be lowered slightly. When I say lowered, I mean it could be lowered in terms of your grades that you're needed to get in. So as I've written over there, offers may drop to as low as 3Bs. So think about it, you've got A star AA, but really, if you are eligible, you could get an offer for 3Bs, which is a massive difference, but it's also a massive burden off your shoulders, because A star AA is very hard to achieve. BBB, also hard, but a little bit more achievable. It's not as intense. But like I said, the criteria to apply to these foundational gateway pathways is quite specific. So it depends on your personal grades. As harsh as this sounds, you shouldn't be a high achieving student to be applying to this, which is a bit It's a bit mean, I know, but unfortunately that's our idea. They want to get people in from kind of lower socioeconomical backgrounds coming into medicine. So yeah, it depends on your grades, it depends on your school type. Are you going to a state school? Are you going to a grammar school? If you're going to a grammar school, usually you are not unfortunately eligible for these pathways. But if you're going to a state school, that to a low performing one, you're more likely to be eligible for this pathway. Also, your postcode where you live, if you are living in a fairly low socioeconomic kind of area, your eligibility will increase for this. Number of resits. Typically, if you have already resat your A levels, you are no longer eligible for this pathway. But if you are in year 12, about to apply in year 13, and you are kind of fitting in all the other criteria, you may be eligible for this. But I would really recommend to double check it. Don't go off solely based on what I've said. Go online, go to the university. There are over 15 medical schools that have foundational gateway pathways, and it's identical to the regular medicine degree, absolutely the same. The only difference is you might have a little bit more pastoral support when you are in your degree. But again, it'll be 5 years or 6 years, depending on which course you're doing, and it'll be exactly the same. But you'll just have a little bit of extra support. So again, resits and UCAT use also come into this because they sometimes lower the UCAT requirement as well for the students that come from widening participation backgrounds. So it's really, really worth looking into this and seeing if you, A, are eligible, B, are the universities that you're looking personally to apply to, are they providing this course? So have a look, see, off the top of my head, I know King's College do this, I know Manchester do this, I believe Exeter does it as well. Queen Mary's does it. Anglia Ruskin, I can tell you, definitely does it. So definitely look into it. Another quick shout, if you are a graduate student, unfortunately you are not eligible for foundation and gateway pathways. This is usually for students that are in school or A levels. So that's that. The next pathway is gap year. Now this is probably the most underrated pathway that people don't take if they do not get in the first time round. And I personally regret not doing this myself somewhat, because I did really enjoy my degree as well. But with hindsight, this was definitely an option I had that I thought I didn't have. So in your gap year, figure out as soon as you get your results, what went wrong? Where did I lose? Did I lose out because of my UCAT? Did I miss out because of my A level grades? Did I miss out because I didn't perform well in my interview? Figure out which aspect of your application went wrong. Then you need to work on that specifically. If it was your UCAT was not strong enough. Okay, when you get your A level results, it's usually around mid-August. UCAT season ends at the end of September. You've got until the end of September to sit your UCAT for the following year's admission. So between mid-August to end of September, you've got around 6 weeks to really, really prepare for the UCAT and make sure you can absolutely smash it. So make sure you figure out if it's your UCAT that went wrong, you figure out what was the problem with your UCAT preparation, you nip it in the bud and you smash that UCAT exam and you get a score that is really, really strong and good enough for you to reapply. If it wasn't your UCAT and if it was your A-level grades, for an example, this is what I should have done in my case, but I didn't, resit them if need be. Now, the reason I put an asterisk next to that is because I would definitely look into whether the universities you want to apply to accept resits. They are becoming a bit more kind of accepting of resits, but some unis still don't accept any resits for A levels, but some do. So if you go onto the website and the entry requirements of a specific university that you'll want to apply to for medicine, you'll see with the A level requirements, it will say sat within a 2-year period, or it might have some information about resitting your exam that you might be able to resit it once with the kind of condition that you have achieved A star AA in the end. So read into that. If it was neither your UCAT or your A levels that kind of went wrong, then maybe you need to strengthen on your own reflection and your work experience. So this probably means that like your interview may have gone wrong, and you need to personally work on yourself and how you come across to an interviewer. So strengthening yourself in terms of reflecting on yourself, but also work experience and volunteering and any kind of experiences you can get within clinical environments to kind of make sure you're more articulate and more clear about what you want when you're in those interviews, because you need to be pretty kind of, you need to almost show off that I really want this. It's not just oh yeah, I'm here for the sake of it. You need to be so strong-headed that I really want to get into medical school, and that needs to be able to shine through the way you answer questions in the interview. But again, I'm going to go through that in a bit more detail. And lastly, again, like I said earlier about the strategy in choosing medical schools, that is so, so important. But yes, again, choosing medical schools more strategically based on your personal statistics. Don't apply for Cambridge if you know your UCAT score is not in the top 2% or top 5, 10%. Why you're going to be wasting an option that way. Rather, look at which universities will definitely offer you an interview based on your UCAT score and apply to those. You'd never know for sure which medical schools take kind of which range of UCAT, but you have a slight rough estimate when you look at the statistics, and I've got which kind of goes through that as well later on. Next is the postgraduate route, which is GEM or undergrad. So this is what I'm doing. So a GEM course, which is graduate entry medicine, is a 4-year course, and this is purely a course with literally just graduates in it. It has no one else, just graduates. Or you can do a 5-year course with the undergrad course. This is what I'm doing. So I'm a postgrad student on an undergrad course. I'm on a course with people that have come out of degrees. I've come on a course with people that have come out of A-level gap years, or I'm on the same course. I've got students that have just come out of their A-levels. So it's a very varied course, but everyone is doing the same medicine degree. So look at which one you want to apply to. The only thing with GEM versus undergrad is GEM is there's a lot fewer seats. There's not that many, there's a lot fewer GEM schools, and they also have a different entrance exam. They've got an entrance exam called the GAMSAT. They do use the UCAT, but some also use the GAMSAT. And like I said, there's a lot fewer seats available, and because of that, it's more competitive to get into than regular undergrad medicine. So I mean, undergrad medicine is already so competitive to get into. GEM is almost 10 times worse. So keep an eye on what you want to do and figure out if you think you want to give it a shot for the GEM, or if you want to go straight and keep it slightly safe by going for the undergrad one. That is what I personally did. So it uses your degree to get in. Typically, an offer would be a 2-1 in your degree, so an upper second class division, upper second class honours, sorry, will be the typical grade requirement for a degree. Some universities will also look at your A levels. So again, read into that. Some universities will say, okay, you need a minimum of A, BB, or A or BBB in your A levels plus a 2-1 in your degree. Some will not care about your A levels. They'll be like, we don't care as long as you've got a 2-1 in your degree. So read into that. Most medical schools will accept bioscience related degrees, but some schools, particularly the GEM ones, it is only the GEM ones, I think no undergrad course does this, but they will accept people from wider degree backgrounds. So you could have done accounting and finance, got a 2-1 in it, but completely shown yourself off through your GAMSAT or your UCAT, and you'll be invited for an interview. So that is definitely also an option. In fact, I've actually got a student in my own course. She is an aeronautical engineer by her last degree, but she changed her mind and decided she wanted to do medicine. And then she transferred, well, she kind of finished her degree in aeronautical engineering, applied for medicine a few years later, and she got in. So it's definitely an option, but you just need to be really, really driven for it. One thing I will quickly mention is that unfortunately Student Finance England does not support tuition fee funding for undergraduate medicine as a postgrad student. This is because this is a second undergraduate degree, and Student Finance England only supports one undergraduate degree, one master's degree for tuition fee funding. So that is a slight issue, but there are ways around it. And if anyone has a question about that, then I'm more than happy to answer that. Any questions?
So did you feel like doing a degree like biomedical science before like entering medicine? Did you feel like that helped with your application in any way?
The actual degree itself, I think it just built my confidence. It taught me how to talk, to be honest. I didn't with hindsight, I didn't really know how to talk back then. When I was in my A levels, I didn't know how to articulate myself. I wasn't confident. Um, Doing a degree generally gives you a lot of experience. It gives you a lot of life skills. It gives you a lot of literally just experience. And not only I'm not even gonna say it's the academic aspect of it. I'm gonna say it's the life aspect of it. Academically, yeah, of course, you're doing a biomedical science degree. You're gonna go through content that's gonna overlap with medical school, but the actual application process of it itself, you will learn so many skills in a degree, any degree, it could be absolutely anything, where you will develop as a person, and that will shine through when you apply for go for your interviews for medical school as a postgrad. So if that answers your question, yes, it definitely does help. But I'm not going to say as much of the academic side, but more so the personal development side. Yes, it does. Especially if you do things alongside it, like volunteering, work experience. If you work a part-time job, I really, really recommend, if you are a degree student, maybe not a medical student because medicine is very, very intense and you literally have no time. But if you're doing another degree, and you can find the time to get a part-time job, especially in a clinical setting, so like a pharmacy, a care home, hospital, GP, wherever, dentist, I would really, really recommend it if you can manage to get yourself something like that. Does that answer the question?
Yes, thank you so much. Does
Yeah.
anyone else have a question? Okay, I don't think so.
No? Okay, perfect. Now, what actually gets you in then? That's a question everyone asks. So you've got your academic grades, which are the A levels or your degree. You've got your UCAT, which has to be a strong score. Typically, a strong score averages around 700 plus across each subtest. So, like 700 in VR, DM, QR, SJT is banded. So, overall average is around 700 plus will be considered a strong score. Your interviews, so proving that you are medicine material, being confident but not overconfident because that comes across really bad, being safe, sensible, and showing a true passion for medicine. But again, something I've been going on about, the biggest thing ever is strategy, applying strategically to your statistics. And like I said, I keep saying I'm going to go through that a bit more depth in a bit. So this is the part that people don't talk about, and this is a bit more of an emotional, mental kind of part of it. When you think, I haven't got in once, so will I actually ever get in? And I've had this thought many times, and I'm sure that everyone who hasn't gone into medicine or dentistry first time has had this thought, thinking that like you failed once, so I have no chance. Thinking, oh, all my friends, they're in their first, second, third year of uni, and I'm still thinking to go back to uni. You know, I've wasted time, or thinking that I'm not good enough to do medicine, or settling for another option because you don't know what else to do and you just like, oh, I may as well do this. But really, that's not what you want to do. And you want to do medicine heart and heart, or thinking, I don't know what to do next. Now, this is quite intense. This can be quite stressful. Someone like for myself, for an example, I had thoughts at one point during my biomedical science degree thinking, what if I don't get into medicine? Should I just do pharmacy? But again, that was like for me, that was this settling for an option you don't really want wholeheartedly. I don't want to do pharmacy, I wanted to do medicine. But in my head, I thought, oh, if I'm not like good enough for medicine, I may as well just settle on the next best thing. But if you truly, truly, truly want medicine or dentistry, I'm going to say, stick to your gut, work hard, and I promise you, keep trying, you will get there eventually. So that's my little wise word of wisdom for that. So the UCAT. Now, this is probably the most dreaded part of applying to medical and dental schools. I hated this exam with my guts. I've done it twice, and both times I hated it. Like, I know I said earlier A levels were the hardest thing I've done. They were, but this was the most stressful thing I've done. I hated the UCAT so much because it's not an IQ test and it's not an academic test, it's a strategy test. And to be honest, sometimes understanding that takes a bit of time. So I'm assuming everyone here knows the UCAT has 4 subtests. You've got verbal reasoning, decision making, quantitative reasoning, and situational judgment. Now, the first 3, you think, how are they relevant to any clinical kind of degree? How are they related to medicine and dentistry? But they're not directly. It's more so the skills that you use in those subtests that are relevant to your degree. And then situational judgment, yeah, that is quite relevant to a clinical degree. But like I said, it's not an IQ test, it's a strategy test. So what kind of strategy do you need? You want to start early. I would recommend at least minimum 6 weeks before your exams start preparing. You want to take short, regular practice, but you don't want to panic cram, because when you panic cram, it's just not going to work. One tip I remember I got given when I was doing my UCAT the second time, and I did this, was to work in 2 hour intervals, because your exam is just under 2 hours long. So you need to train your brain into getting used to working on the UCAT on this horrible interface with these horrible things for 2 hours straight. You don't want to do too less in case you train your brain to do less and in the real exam you get tired. But you don't want to do too much, that you burn out. So 2 hour intervals. So what I used to do 2 hours every day for the first 3 weeks. Then I started doing 2 hours twice a day for the last 2 weeks. And again, my final week before my exam, I just did 2 hours a day again. And I used to do mock exams. And if I wanted to do an extra one because I was just feeling a bit adventurous or not as tired, I used to do an extra one. Also, review your mistakes. Don't just count the completed questions. Actually understand what you're getting wrong, because that's how you can improve. You'll notice there'll be trends when you're doing your UCAT on things that you do better on, things that you do worse on. Figure those out and work on them more specifically. If you're not doing good in decision making, okay, what is it in decision making you're not doing good at? Is it the Venn diagrams? Okay, I need to work on Venn diagrams. Go on to a speed trainer, or go on to a skill trainer on MedEntry or Medify. Figure out why is it I'm still slacking on Venn diagrams, and really, really practice those and nip them in the bud. Also, you want to practice timing. That's probably the hardest aspect of the UCAT, is the timing, because you're doing so many questions in such little time. Like in VR, you're doing 44 questions in 22 minutes. That's 30 seconds to read that really fat passage of text as well. So you want to practice speed, you want to practice timing. I really, really recommend speed trainers on, I think it was MedEntry. Yeah, I think it wasn't Medify. MedEntry has a speed trainer and it was amazing. I used that so much. It was really, really good. So I really recommend that. But also learn when to just guess, flag, and move on. Do not aim for 100% in the UCAT. You need to accept the fact that you're not going to get 100%. Rather, you need to kind of learn how to just guess, flag, and move on. And make an educated guess, of course. Don't just randomly pick a answer, just like eeny, meeny, miny. Don't do that. Do a process of elimination, an educated guess, flag, and move on. So the thing I've been drilling on about, apply strategically. You want to match your UCAT score to the medical schools that you're applying to. Now, majority of people, when they apply during A levels, they will have the predictions of A-star AA or 3As. The next thing that cuts you out or eliminates candidates is your UCAT score. You want to make sure you've applied to schools where your UCAT score is deemed as good enough. So I've got a list over here. I'm just going to preface by saying this is a rough estimate for the UCAT scores. It changes every year, and actually no university officially announces what their kind of UCAT cutoff is. It's more so myself and a few other medical students that have kind of gone into their admissions files and kind of dug out what are the average UCAT scores that get into these unis every year. So like I said, this is a rough estimate. I would not use this as a holy grail, but keep looking at it and have an idea. So between 2,100 to 2,250 is deemed as a particularly high score. And universities like Oxford, Cambridge, Edinburgh, Bristol, King's, Hull, York, Leeds, Newcastle, Sheffield, Birmingham, and Southampton are deemed as high UCAT graded unis. So if you've got a really, really strong UCAT, yeah, you can go for those. You can give them a try. There's no harm. It's not guaranteed you'll get an interview, but it's worth a shot. Then you've got your mid-range unis, which are 1,950 to 2,100. Again, very, very high score, but not as high as the top range one. This is like Manchester, Queen Mary's, East Anglia, Exeter, Anglia Ruskin, Edge Hill, St George's, Liverpool, Plymouth, Nottingham, Aston, and Glasgow. And then you've got the lower graded UCAT unis, which are like Cardiff, Sunderland, Keele, Queen's Belfast, Kent, Medway, and Lincoln. And if you're Scottish, I'm not sure if anyone's Scottish here, but if you're Scottish, then applying to Aberdeen, Dundee, and St Andrews also lowers the entry requirements for the UCAT. So this is kind of what I mean when I say apply strategically, have that in your head. If you've got 1,940 in your UCAT, don't apply for Edinburgh, don't apply for Bristol. You'll be wasting an option. You'll probably get an automatic rejection. And I know that sounds really, really harsh, but sometimes we need the harsh truth. Apply strategically and apply for somewhere you know that your UCAT score will be considered. So that's that. Does anyone have any questions about that? No?
What resources did you find the most useful for the UCAT?
So I used everything to be honest, because I hated the UCAT. So for me, I just wanted to do as well as I could in it. So the most well-known one is Medify. Um, and MedEntry is also really, really good, and also the official UCAT consortium, the official bank. So when I did my UCAT, I used all three. I used Medify, I used MedEntry, I used the UCAT consortium. I initially only used the UCAT consortium and Medify, and I think it was in the last 4 weeks I also did a subscription for MedEntry, and I was using all of them because I wanted to do as many as practice tests as I could, as many past papers as I could. So each Medify has its own kind of bank of past practice papers. MedEntry has its own. The UCAT consortium has its own. So I kind of jumbled them all up, and I had like a massive bank of practice papers that I could do. But not only that, each of them have their individual banks for each subtest. So like I said, when I did it, there was an extra subtest. So I used to have just a kind of a mini mock for VR, or a mini mock for DM, or a mini mock for QR. So I personally, out of all three of them, I think Medify is probably the best. It is a little bit harder, I personally think, than the actual UCAT exam, but that might be my bias. I'm not too sure. I personally found it a little bit harder than the real exam. MedEntry was really, really good. I think that was a bit more reflective of what the UCAT was actually like, but I'm someone that believes that you should go through, revise on the harder thing, so that when you do the actual thing, you feel a bit like, okay, yeah, you feel confident. So I would use Medify definitely, and UCAT Consortium 100%. That you cannot get any more accurate than that. But yeah, that's what I used. Is that okay?
Yeah, thank you so much. Does anyone else have any questions? Nope. Okay, I think you're okay to move on.
Perfect. Okay, now coming on to the interviews. Now, like I said, once you've kind of given your predictions, your predicted grades in, and your UCAT is given in, your UCAT will kind of eliminate a lot of candidates. Then comes your interviews. If you have kind of made it past that first round of elimination after the UCAT, you need to then prove yourself when you get invited to an interview. And it literally is that when you go to your interview, you're proving to them that you are the right choice for medicine. Now, one massive, massive tip I would give you is research the core values of the medical school you're doing your interview for. Now, a very nice quote that I actually heard one of my friends say when they were kind of also helping students for interviews was that there's no point of being the best shade of blue if the interview is looking for the color green. Now, I think this is so good because sometimes we think a medical school wants to hear us say something and it's not. Rather, they want to hear you say something else. And you didn't say that, even though you could have very easily said that if you knew, and then you'd lose your space. So definitely research the core values. And another example I can actually give you was my own personal example. When I did my interview for Anglia Ruskin, just before my interview, funnily enough, I was on my way to the university and I quickly went on my phone and I researched, oh, what are the core values for Anglia Ruskin Medical School? One of the top ones, there was a list of, I think it was 7. One of the top ones was integrity. Now, my very first station for my MMI interview at Anglia Ruskin was the scenario. It was that I am a placement supervisor and I've received a series of complaints about students on placement. Rank these 6 complaints in order of most important to least important. This was my actual MMI station, by the way. And I remember I did my ranking and I said, yep, I would do it like this, this, this. One of the cards was that you're trying to contact the student, but they are unreachable. You can't get through to them. And I ranked that, I think, as number 2 or 3. I can't really remember. And the interviewer, he was a lovely guy who I now know to be one of my lecturers. He said to me, why have you not put that at number 1? And I explained my reasoning, and he goes to me, well, it could be that he's dead. because he's committed suicide, because suicide rates among medical students are really, really high. And at that point, I got so startled, I thought, oh, I didn't think of that. Genuinely, I didn't think of that. And the first thing that came to my mind is Anglia Ruskin's core values are integrity. What is integrity? Integrity is owning up to when you've made a mistake. So I said, oh, actually, yeah, you're right. I didn't think of that. I would actually put that as number one. And that was it. And I now know, 2 years later nearly, that I actually nearly scored full marks in that station purely because I was honest. And I said, actually, yeah, you've got a point. I didn't think of that. So research the core values is what the moral of the story is. Figure out what they want, figure out what they're looking for, and then shine through with that, and you should be fine. Also, just be a nice person. Stay calm. It is a very nerve-wracking experience, but don't let your nerves actually overshadow your personality because you'll just become a robot. And the way you need to kind of think of it is that these interviewers, they're doing hundreds of these interviews, and they're going to say, most likely see the same box standard robotic answers. So you need to, one way you can make yourself set apart is just by bringing your personality in, because your personality is personal to you. So let that shine through. Go into the station, shake hands with the examiner or the interviewer and introduce yourself, and then go from there. Next, good interview answers are specific, reflective, and patient-centered. They're not memorized things. Don't memorize something. I'm literally telling you guys right now, do not memorize speeches. Cater to what you get given, cater to the question they ask you, and just be prepared on the spot. So key topics that kind of come up in interviews include communication, ethics, teamwork, empathy, reflection, resilience. You sometimes also get role plays, which in my opinion are quite fun. I mean, I say that now, in the moment they were quite stressful, but they are quite fun to do. So yeah, these are kind of key topics that can come up in your MMI or your panel interviews, depending on which university you get invited from. Now, one question, well, no, it's not one, multiple questions that can get asked in your interview are, why not so-and-so other healthcare fields? Why not biomedical science? Why medicine and not pharmacy? Why are you choosing to be a doctor and not a paramedic? Why doctor and not a nurse? Or why not a PA? Or why not a dentist? Now, you need to be prepared to answer this very, very diplomatically. You need to be, first of all, the first thing you need to do is figure out how a doctor or how a medic varies from a biomedical scientist, a pharmacist, a paramedic, a nurse, a physician associate, or a dentist. What is different in these careers? The most common one you will get asked is nurse. Why nursing and not nursing and why medicine, or why medicine and not physician associate? That's probably the most common one, but you can get asked any of these. So make sure you know why medicine or being a doctor differs from these careers without actually infuriating any of these careers, which unfortunately does happen in a lot of interviews. People will think, oh, that's because I want to be a doctor. But why? Why a doctor is not superior to any of these professionals? So why? And you need to really diplomatically answer this by actually expressing why you want to be a doctor and not a nurse. So for an example, why do you want to be a medic and not a nurse? I remember I got asked this question. My answer was that nurses have a really, really intense job, and they physically really look after a patient, and they really, really take care of a patient, or their emotional needs, their kind of, physical needs. They're really, really there actively looking after the patient. A medic, on the other side, does a puzzle working job. And this is a job that a nurse doesn't do. A doctor will see, okay, these are what the bloods say, this is what the scans say, this is what the CT or the MRI says, this is what the patient is telling me how they feel. Right, I need to put this puzzle together now and figure out what's going on. This is something a nurse doesn't do. A nurse acts on what the patient is presenting on, but a doctor actually solves the issue. And that was my literal answer that I gave in my interview. And I thought it was a really, really good answer. And from the interviews that I've done in the past as well now, well, this year, I also saw only a few students very diplomatically answering this question of why not another healthcare field and why medicine. So yeah, I would really, really be careful on how you answer these questions, but also be honest and acknowledge how these other professions are so, so important. I'm hoping everyone here knows what an MDT is, a multidisciplinary team, and how every single member of listed over here and many more are a part of this MDT, and a patient's safety and a patient's care is fully done through this MDT, not just the work of a doctor. So you really need to kind of look into these and see why not the other fields. And use keywords in your interview as well. MDT, what I just said, is such a massive keyword. If you say that in your interview, you will impress the interviewer that, okay, they know what an MDT is. That's really, really good. So overall, kind of talking from start to finish, your application will involve your grades, your UCAT, your interview, your reflection, but most importantly, your strategy. Your strategy is the most important part of your interview, of your application process. And you need to make sure that your strategy is top notch, because your strategy is what's going to get you in. So a strong applicant will not only meet the academic requirements, they will choose universities wisely or medical schools wisely that fit their the requirements that they've got. And they'll reflect on the experiences that they've gone through in terms of work experience, volunteering. If you're a graduate, your actual degree, you'll be able to communicate under pressure, which will shine through during your interview, because you are under pressure in your interview, but you need to be able to still communicate very eloquently and fluently. But also you need to be able to show insight into the role, and that you know what is involved in the role of being a medic, not just, I just want to be a doctor for the sake of it, like I just want the title. Trust me, it's not all that. It's a very tough degree. It's not as rosy as it seems. So you need to be able to kind of acknowledge that and present your kind of resilience as to why you still want to do this career and why you still want to be a professional in this industry. So, does anyone have any questions? I feel like I've yapped on for a very long time.
If you could start your application again, would there be anything that you would do differently?
Is this my application as a graduate or as an A-level student?
Um,
Both?
both? Yeah.
Both? Yeah, of course. So during my A levels, I would say I lacked a lot of guidance, and I don't. I think at A levels it's very, very difficult. You're very young. You're 17 years old when you apply during your A levels, and you're very young. You're very naive. You don't really know what you're doing, especially if you've come from a family where there's not many medics. If you don't have any older siblings, you don't always know what is expected of you in terms of your UCAS application, your UCAT. So I think if I went back to my A levels, I would just question more. I would question things at school. I wasn't. I'm now looking back now. My school wasn't the most. I don't want to say supportive. I think they just didn't know themselves, to be honest. They didn't really know what it entails to actually apply to medicine or dentistry. So just question things. Do your own research, which I know at 17 is not always. You don't really think about it like that. But if you're determined enough, you will do it. Um, I hands up admit I don't think I was as driven and determined at 17 as I was when I applied as a postgrad. So ask questions, do your research, and know again applying strategically. But I also think this kind of idea and concept of applying strategically came to me with time and experience. In terms of after my degree, if I did something differently, what would I do? That's a really good question, actually. What would I do differently? I think I would not be as harsh on myself, to be honest. That's probably the best thing I can say, because I was very harsh on myself when I applied during my degree. And I would also just cut yourself some slack. You're doing a whole degree, that's no small thing. Sometimes, as a post, if you've started a degree with the sole intention of doing it to get into medicine or dentistry, you sometimes overlook the fact that you're actually doing a whole degree. That's a very big deal. Me, myself included. I don't give enough credit to my biomedical science degree. I just think, oh yeah, it was whatever. But really, it is a big deal. So give yourself credit and be proud of yourself that you're doing a degree. It's not a small thing. And yeah, I'll just be easier on myself, because I think for me especially, I held myself to such a high standard for no reason. It was only me that did it to myself. That I was like, okay, I got 4 interviews. Now I need to get 4 offers as well, which I didn't. I got 4 interviews, but I only got 2 offers in the end. So I wouldn't say I was disappointed, but I was a bit disheartened. Still got into medical school, which is what matters in the end. But you shouldn't be. You just need 1 interview, 1 offer. That's it. That's all you need to get in. So yeah, I would say just be a bit easier on yourself and enjoy the process. It's intense, but it's so worth it. And in the end, you will thank yourself for going through that trauma.
Thank you. There are a couple of questions in the chat. I'll read them out for you.
Perfect. Thank you.
So the first one is, what's the best way or most efficient way to review your mistakes in your UCAT?
So when you do practice, especially on Medify and Med Entry, when you do, first thing I would do before you start your as soon as you start your UCAT kind of journey, I would do an initial mock test with no revision, no nothing. Do your initial mock test and see what result you get. Actually, you know what? I can show you guys. Sorry, I'm just going to quickly stop sharing my screen for 2 seconds. I actually have my UCAT tracker from when I did my UCAT, and I can show you guys that just to show you how powerful the art of reflecting on your mistakes is. I'm just going to get it up. Give me 1 second. I should have added this into the PowerPoint. I'm sorry about that. Where is it? Here it is. Okay. I'm just going to share my screen again. Okay, so can you see my screen?
Yes, you can.
Okay, so this was my personal UCAT revision tracker from when I did it. Now, I'm a bit type A. I made a whole Excel spreadsheet. I know I'm a bit OCD and a bit type A, but that's what I did. This was how I tracked my revision. So anything for me that was in the red was meant that I was scoring less than 600. 600 to 700 was amber. For me, anything above 700 was a good score. I was happy with that. So that was green. Now, in terms of the question, which was how do you reflect? The idea is that when you do a mock paper, you're going to see the result that you get in that mock paper. And usually the softwares like Medify and MedEntry, they will kind of break down exactly what you got wrong. Which questions did you get wrong? And then they'll tell you, okay, you got percentages questions wrong in QR. You will see yourself that, okay, I'm getting percentage questions wrong. Or in decision making, I'm getting syllogisms wrong. Or in VR, I'm getting the true, false, can't tell questions wrong. And then you yourself want to go and analyze, why did I get them wrong? So for an example, in the VR questions, if you're getting true, false, can't tell questions wrong, you need to figure out, am I assuming things? Am I making assumptions based on what I've read to answer the questions? Because in the UCAT, you cannot make assumptions. You have to go off of the facts that you see in the question. So for an example, and you also cannot bring any external knowledge. So for an example, if the UCAT says the sky is green, you have to accept the fact the sky is green. And if your question stem is saying that this passage is suggesting that the sky is green, true, false, can't tell, and you are like, oh, I don't need to read the passage, I know the sky is blue, false. But actually, in the passage, it says the sky is exuding a hue of khaki, for an example. Khaki is a shade of green. You then are like, oh no, it's saying it's a shade of green. So the answer is true. You cannot bring your own knowledge into the exam. So you need to figure out what is the patterns, why am I getting things wrong? Luckily, a lot of the softwares like Medify and MedEntry kind of do that really tough analysis for you. It will give you like, you're getting these questions wrong, you're getting these questions wrong. And sometimes I remember from when I did it, it gives you a graph. And in that graph, you'll see the percentages of which questions like specifically you're getting wrong. And then when that happens, what you can do is you can go on the skills trainers on Medify and MedEntry, or you can actually do specifically those questions within those softwares just to practice them a bit more. And the more you practice, the better you'll get at it. There's no doubt in that. Anything else?
So the next question is, how did you find work in a clinical setting as most positions require previous experience?
Yeah, this is quite hard, I'm not going to lie. I was quite lucky in the sense that I walked into the pharmacy. So I worked in a pharmacy. I walked into the pharmacy and I kind of just said, I kind of want work experience. They were like to me, yeah, sure, come in for work experience. I was meant to be there for 2 weeks. They were severely short-staffed and they just kept asking me to come back, come back, come back. Until one day the pharmacy manager kind of said to me, do you want to just work here 1 day a week? And I was like, sure, it's a bit of money. Can't really say no to that. It's a pretty easy job as well. And then and I just grew from there, to be honest. I just did 1 day a week, then I did 2 days a week, and then I used to go during my holidays a lot more. I used to help out a lot. So then throughout my whole degree, pretty much, I worked there the whole time. For 3 years, I did. Um, in terms of how to get it, pharmacy is a very, very good place to get it. It's probably, I would say, the easiest place to get a job if you want to get a job. More the easiest way to do it is just walk in. I would say just walk into your local pharmacy, be like, "Hi, I'm so and so. I'm looking to do some work experience." I would recommend starting off by asking for work experience rather than a job. So yeah, just ask, I'm looking for work experience. Can I like come in for maybe 1 day a week or for a few weeks? Or if you want to do a block, can I come in every day for so and so? And liaise with them, work with them, and figure out how they can kind of help you. So yeah, for pharmacy, I would recommend that. In terms of the volunteering at the hospital, so find out which trust you want to do it at. So I did it at Bart's Trust, and Bart's Trust had a volunteering page online. So how to volunteer with us, just fill out the form and they'll get back to you. And that's quite literally what happens. So if you fill out the forms, they'll get back to you. You kind of choose a role, what you want to do. So you can be something called a befriender. You can do things like meet and greets, where it's like you kind of welcome patients into the hospital, take them to the wards that they need to go to. Befriending is something like when you go to the wards and you go speak to patients that are lonely, that don't really have family that come visit them and they've been admitted in for a long time, play games with them, read them books, newspapers, quickly pop to the shops to go get them something. You can be an active responder, where that was something I did, where like you'll have a bleep and if a patient's about to get discharged, this is called TTOs, the pharmacy will quickly give you a bleep to quickly run to the pharmacy, grab their discharge medications, go back up to the ward and give them to the patient. So it's just these tiny, tiny jobs that you can do. But the way to get them is you have to go through the official route for volunteering. So I would go onto the Trust's website, just search up. So for an example, for me, it was Bart's Trust. I just searched up Bart's Trust volunteering, and it'll take you to a page and just follow through that. And yeah, you should get some sort of volunteering. In terms of work experience, like surgery, I'm going to be honest with you, it's just contacts, knowing some people. If you know someone, definitely get in touch with them and say to them, I'm looking to do something like this. Would you be able to squeeze me in? And then yeah, they should hopefully be able to squeeze you in. In terms of the dental work experience, I just went to my local dentist, to be honest. I did actually go to them during my A levels, but because of COVID, they said no. But afterwards, yeah, just go to your local GP practice, local dentist, just go say, hi, I'm so and so, I'm looking to apply to medical school or dental school. And I was just wondering if you would be happy for me to shadow you for a few hours. And that's it. But yeah, I would suggest quite literally just be open about it. Just go talk to them. I don't recommend emailing and stuff, especially for like GPs and pharmacies and dentists. Just walk into the reception and have a chat with them.
So the
Anything
next
else?
question is, what's the best way to get the most out of your undergrad degree as someone who wants to do medicine afterwards?
Do you mind me asking what degree you're doing?
Biomed, for example.
Okay. So I would say, first of all, have loads of fun. Medicine is not the same. Medicine is very, very intense. The amount of free time you have in a biomedical science degree, nowhere near as much free time in medicine. So have lots of fun. In terms of making the most of it as for a potential application for medicine, I would say, like I said, getting volunteering or work experience or a job. You trust me, it's underrated how much a job influences your personal development skills, how to talk, how to walk, how to have do things with other people. You learn so much from it. You learn things like empathy. It could be as simple as you working in a retail job. You will get customer facing skills, very similar to patient facing skills, but these skills slowly add on. So yeah, I would definitely recommend making the most through your at the time of your degree with that. Actually, academically with your degree, attend all your labs if you're in a biomedical science degree. Go to all your labs. Trust me, labs are such good ways of kind of expanding on your skills. Um, Work your hardest to achieve a first class. And I know the entry requirements for medical school is a 2-1. 2-1 will be more than enough for you to get in. But if you aim for a first, you just put yourself perfect personal satisfaction as well, to be honest. You're not going to be ahead of anyone if you've got a first instead of a 2-1. But for personal satisfaction, go for a first, aim for it. You're more than capable of doing it, so do it. If your university offers a chance to do a dissertation, I would 100% recommend it. It's long, I know, but do it. Do a research project. So I personally did a research project in my final year. I did it on focal epilepsy, but that research project has given me something to talk about in all my interviews. I mentioned it. Also now, whilst I'm in my actual degree, you will, as a medical student, you're going to have to do research projects. So if you've done it once before in your biomedical science degree, it comes a bit more naturally to you in your medical degree. So yeah, grab any research opportunity that you can. Try your best in all your exams and all your assignments. Aim for that first class, because trust me, it pays off in the end.
What were the 4 universities you applied to for medicine?
So I applied to Anglia Ruskin, of course. I applied to Anglia Ruskin, Queen Mary's, St George's, and UCL. So I live in London, so I actually want to stay at home. So I stuck with home unis.
What made you choose undergrad instead of graduate entry medicine?
Purely out of fear, to be honest. Because, like I said, graduate entry medicine is a lot harder to get into because A, there are fewer schools, B, there are a lot fewer seats. So for an example, I can't remember I can't remember which university it was, but their graduate entry school had 30 seats, whereas their regular undergrad had 500. So, like, am I going to risk going? This was me personally. Like I said, if you feel strong enough to do it, go for it. I personally just really, really wanted to get in first time. So for me, I was like, I'm not going to take the risk. I'm just going to apply straight to undergrad. But yeah, I think it was fear, to be honest. That's my honest answer. It was fear of not getting in, because you compete against sometimes much more highly professional people when you apply for graduate entry medicine. You might be, competing against fully qualified pharmacists with like 10 years of experience, or fully qualified nurses with 5 years of experiences. And, little me, who just graduated from a biomedical science degree, nothing else, I just didn't personally think I wanted to take that risk. But don't get me wrong, I know people that have done it. So it's definitely doable, but it's a personal kind of choice on if you're willing to take that risk.
Does anyone have any other questions? Okay, I just wanted to say thank you so much, Malika, for presenting,
No
because
worries.
as someone who is currently doing biomed and is thinking of going through the same route, you're like hearing about your process has been very like inspiring, and I'm sure that our members, no matter what route they decide to take, would find your information and your advice to be very useful as well. So thank you so much for putting the time and effort into your presentation and to answering the questions as well.
No worries, that's absolutely fine. I'm glad I can help. I've attached my LinkedIn on a QR code here. So if anyone has any questions later on down the line that you couldn't think of right now, feel free to send me a message. And yeah, thank you for having me, and good luck, everyone.
Thank you. Also, to our members, if you haven't already, please can you fill in the evaluation form as well? Thank you.
Thank you, guys. Good luck.